Welcome to our video on depression triggers and coping mechanisms you should understand. In this insightful discussion, we delve into the intricate interplay between depression triggers and the coping mechanisms that can help navigate through challenging times. Join us as we explore essential insights and strategies to better understand and manage the complexities of depression. Let's embark on this journey together towards greater awareness and resilience. Millions of people worldwide suffer from depression, a common but dangerous mental illness. Among other symptoms, the disease can be characterized by feelings of hopelessness, chronic unhappiness, lack of interest, and lack of motivation. Effectively managing depression may involve understanding what sets it off. Both internal and external triggers are included in the discussion of depression triggers. Anything can serve as a trigger, including sights, sounds, smells, or occasions that cause uncomfortable feelings to surface. Depression triggers can be subtle or overt, and their effects on you can vary depending on what they are. You may not experience depressive episodes for the same reasons that I do. Hormonal fluctuations, unfavorable thoughts, trauma, stress, significant routine changes, chronic illnesses, etc. are a few typical examples of depression triggers. More typical depression triggers are covered in this video, along with coping mechanisms you might employ to deal with them. Come with me while we examine depression triggers you should be aware of. If you have previously received a diagnosis of depression, you may become more cognizant of your symptoms and may experience less surprise when they recur. You may find it challenging to pinpoint your depression triggers if you have never received a diagnosis. Here is a summary of some typical depression triggers to assist you in recognizing and managing your own triggers. 1. Tense situations. One of the things that might cause depression is going through stressful situations, whether they be at work or in your relationships. If you don't find a way to release your stress, it will eventually lead to burnout and depression. Reducing stress can assist you in avoiding the onset of depression and its accompanying emptiness. 2. Abnormal use of substances. Overindulgence in alcohol and other recreational drugs can also be a contributing factor to depression. These drugs alter brain chemistry in ways that make it difficult for you to feel happy. This may result in psychological and even physical dependence, bringing on depressive symptoms. 3. Difficulties. Sleeping. Insufficient sleep has the potential to exacerbate depression as well. Our well-being depends on getting enough sleep, and not getting enough sleep can have an impact on our emotions, thoughts, and moods. Sleeping sufficiently at night can help avoid depressive symptoms from coming on. 4. Losing a close relative. Grief may also be a trigger for depression. You may be more prone to depressive symptoms while you're grieving the loss of a loved one. You must realize that if you don't get help for your depressive symptoms, the sadness you experience at a loss can become depression. 5. Adverse self-talk. Depression can also be triggered by harboring pessimistic thoughts and letting your inner critic rule your mind. Because your thoughts and emotions are interconnected, having pessimistic thoughts makes you feel more down. Social isolation brought on by negative thoughts might exacerbate depressive symptoms. 6. Pharmaceuticals. Depression may also be exacerbated by some drugs. It is advised that you discuss the adverse effects of any medications you are taking with a doctor. Certain pills, including birth control pills and even steroids, can cause depression, so before taking any, make sure you understand the negative effects.
Seven, the turning of the seasons. Seasonal fluctuations are unavoidable when discussing factors that contribute to depression. Yes, depression can be brought on by a change in seasons. The illness known as seasonal affective disorder, SAD, can lead to mood swings, a decline in interest in activities, low energy, restless nights, and a chronic depressive state. 8. Memoria of traumatic incidents. An additional frequent cause of depression could be the anniversary of a terrible incident. Anxiety, dread, grief, and even helplessness might be brought on by traumatic anniversaries, along with unpleasant memories. In addition, these symptoms may set off intrusive thoughts, dissociation, nightmares, and flashbacks associated with PTSD. 9. Modifications in hormones. As we age, our bodies go through hormonal changes, which most of the time can also be a trigger for sadness. Feelings of depression, poor energy, lack of motivation, and more can be brought on by physical changes in the body during adolescence, pregnancy, and menopause. Depression symptoms may be more common in women who have PMDD or PCOS. 10. Experiencing rejection. Feelings of rejection, insecurity, and low self-worth are additional factors to be aware of as depression triggers. Your depression may be triggered if you are feeling these things. Feelings of rejection, abandonment, and social isolation can also result from these emotions. These emotions may surface in relationships, friendships, or even the workplace. 11. Joblessness. Being unemployed may be another factor contributing to your depression. Losing a job means losing your regular schedule, structure, and perhaps your source of income. All of this could make you feel depressed, hopeless, and rejected, which could lead to depression. 12. Problems with relationships. Depression may also be brought on by problems in your relationship. Breakups, divorces, and separations can all result in depressive symptoms like melancholy and poor self-esteem. 13. The blues after giving birth. Although having a child or giving birth can be an exciting life event for the parents, it may also act as a trigger for sadness. Postpartum blues can lead to postpartum depression and affect both mothers and fathers. In addition, hormonal fluctuations may occur in women, which may set off additional illnesses like anxiety, premenopause, and bereavement. "14. Syndrome of the empty nest. An empty nest may be a depression trigger for you if you have adult children. While having children around is wonderful, when they go, it can be easy to feel lost and grieved. Depressive symptoms may arise as a result of these empty feelings or a sense of an empty house. 15. Getting older or retired. Retirement, especially for working professionals, is an inevitable aspect of aging. Retirement is something that a lot of people look forward to, but it's also a significant change in routine that might cause depression if you're not acclimated to it. You might suffer from a loss of direction, hopelessness, existential crisis, or even a loss of purpose during and after retirement. You may have emotions of isolation, loneliness, and anxiety as a result, all of which can lead to depression. 16. Suddenly stopping therapy. Relapsing into depression is a possibility if you are receiving treatment for depression and decide to stop. You may feel worse rather than better if you stop taking your medicine or therapy suddenly. For this reason, before discontinuing your treatment, speak with your physician. To avoid a relapse into depression, you must be prepared with coping mechanisms. Insufficient social support. When it comes to managing and treating depression, social support can make a big difference. An absence of social support might exacerbate depressive and lonely moods. You can feel more at ease, helpful, and like you belong when you have a support network. You may find it difficult to effectively manage your depression without these. How can you manage your depression's triggers? We must constantly navigate the unforeseen curves and twists that life throws at us. We must be conscious of the things that make us uncomfortable in order to protect our well-being at all times. Depression can be brought on by a variety of causes, including genetics, family history, and even changes in the environment. It's not impossible to relapse into depressive symptoms even after you've overcome them. You may still be vulnerable to situations that cause depression. One activity, frequently, try to get in at least 10 to 15 minutes of activity each day. Engaging in physical activity can elevate your mood and lessen the signs of depression. Walking or yoga are good places to start, and you may gradually increase the intensity. 2. Establish a routine. Depression can disrupt your daily schedule, making it difficult to feel confident in your routine. You can try to establish a routine that works for you in order to prevent this. You can use time management applications to organize your work or set aside certain time for each task. 3. Journaling is another strategy for overcoming and avoiding depression triggers. As a cathartic release and a way to get insight into your ideas and feelings, write down your thoughts and feelings. Use a few brief diary prompts to get started if you're not sure where to begin. 4. Treat yourself with kindness. If you go through a recurrence of depression, try not to be too hard on yourself. Show patience and kindness. It's okay, tell yourself. While you concentrate on overcoming your triggers, be mindful of them and provide kindness. Ensure that your mental, physical, emotional, and even spiritual needs are met. To satisfy your needs, take care of yourself. 5. Make time to socialize. Schedule some time to spend with your loved ones. Talking to trusted individuals about your feelings might help and soothe you. Maintain your social connections and involvement. 6. Get enough sleep. The importance of sleep for your health cannot be overstated. A lack of sleep, even good sleep, can throw your mental equilibrium off. Thus, be sure to establish a regular sleep routine and focus on enhancing your sleep hygiene. 7. Steer clear of alcohol and caffeine. These substances can exacerbate your depression symptoms and, in certain situations, even cause them. If you find it difficult to abstain from these substances when you're depressed, consider seeking professional assistance. 8. Consume a balanced diet. Your emotions and ideas are influenced by the food you eat. Make sure to include foods that lessen feelings of depression in a well-balanced meal plan. Avoid processed and sugary foods that make you feel depressed and hopeless. 9. Engage in meditation. You can avoid and manage depression triggers by engaging in practices like mindfulness and meditation. You may control your stress and lessen your feelings of worry by practicing progressive muscle relaxation, PMR, deep breathing, and grounding activities. 10. Getting professional treatment. Don't be afraid to get professional treatment if you're suffering from depression symptoms, a relapse in depression. A therapist can assist you in recognizing and processing your triggers, as well as teaching you appropriate coping mechanisms. Concluding the matter, though they can make you feel powerless and out of control, depression triggers can be addressed. You can learn to move on and manage depression triggers if you have the appropriate coping mechanisms, social support, and a little bit of professional help. Just keep in mind that it's acceptable to relapse into depression. Acknowledge your needs and treat yourself with kindness. It's not that difficult to recover. There will be moments when you feel uninspired and unsupported, but try not to allow these emotions control you. Don't push yourself beyond your limits and record your progress. Being aware of depression triggers and having coping mechanisms to deal with them might boost your self-esteem. Let no one stop you from moving on. Stay resilient and never give up. And remember that you only need to reach out to get support. We hope this video has given you some insight into typical depression triggers and coping mechanisms. Please share your opinions in the comment section below. Be careful and never give up.